even the smaller sections can spark significant change in healthcare sustainability. Hi, I'm Pei Kee. I'm an anaesthetist here in Singapore. I've always tried to do my bit for the environment, but it wasn't until I started seeing all the waste generated in our daily practice that I knew I had to do something more. We noticed that there was a high amount of Desflurane use in relation to other hospitals around the world. We realized that there was inadequate awareness of the environmental impacts of Desflurane, and so one of the things we decided to do was to organizing talks and inviting esteemed speakers from overseas to come and talk about the problems. We also pasted stickers and infographics on our anaesthetic machines to remind clinicians of the impact of their day-to-day practice. And lastly, what better way than to embed environmental sustainability into our curriculum. So since 2021, we've managed to reduce our Desflurane usage by 98%. And that's equivalent to removing 400 cars off the road of Singapore annually. Because Desflurane is much less potent than sevoflurane and is significantly more expensive as well, we've managed to achieve savings of 340,000 Singapore dollars every year since our project was started.
The main challenge is just giving assurance to our colleagues that if you want to use Desflurane, it is actually still there. So we give our colleagues the assurance that they had the freedom to try, and if they didn't trust us, they could still move back to Desflurane. And we found that actually there were quite significant portion who were immediate adopters, and we still face some pockets of resistance. We should all be physicians first, and as physicians, it's always do no harm. The environment imposes a significant impact on people and their health as well. And by not harming the environment and achieving a similar outcome in patients, you can achieve a win in all the different categories.